Finally, let me address the current state of COVID-19 in Alberta, particularly the Omicron variant. We continue to see encouraging trends with a continuing decline in the number of total active cases, a gradual decline in the positivity rate for positive PCR tests. A week ago, we were at over 51,000 total active cases in Alberta. We're down to 35,000 now. We've continued to see a gradual decline in the number of patients hospitalized in intensive care units with COVID-19. However, significant pressure in our major urban hospitals, particularly in Calgary, but also in Edmonton, and particularly in emergency wards. And we continue to see unusually high numbers of frontline workers who have had to stay home and are absent because of self-isolation due to COVID infections, as well as our frontline workers just being exhausted after the two past incredibly difficult years. So while these overall trends are encouraging, and we clearly did reach the peak of Omicron infections approximately 2 weeks ago, and it appears that we reached the peak of ICU pressures a couple of weeks ago, we are not out of the woods yet. And I implore Albertans to continue to be mindful of this, of the pressure on our healthcare system. So as frustrated as everybody is with the 2 years of COVID in our lives affecting so much of what we do every single day, we need to continue to be careful and mindful of the nurses and doctors and other frontline healthcare workers who continue to operate under real stress. Now, we continue to monitor these numbers very closely. As I've said before, once we begin to see a sustained reduction in COVID pressure on the hospitals, I am looking forward to being able to make decisions about moving towards relaxation of public health measures at that time. And I believe that will happen this month in February. We need to see a sustained decline in hospitalization pressure, but with the overall trends, I am very optimistic that we will be able to move forward with meaningful relaxation of public health measures this month, including the elimination of the restriction exemption or proof of vaccination program. So I just ask people to be a little more patient as we are still at a record high number for non-ICU COVID hospital admissions. We need to see those numbers start to come down, and then I am confident we'll be able to move forward safely and prudently.
Over the last 24 hours, we have identified 1,980 new cases of COVID-19 and completed about 5,000 tests. Our positivity rate for lab-confirmed cases was very high yesterday at about 40%, although our 7-day average is slowly declining. Our hospitalizations for COVID-19 may be beginning to plateau, although it is important to note they are still currently higher than at any other time in the pandemic. There are currently 1,585 people total with COVID-19 in hospital, which includes 109 in the ICU. Sadly, more Albertans continue to lose their lives to this virus. Over the last 24 hours, 13 new deaths have been reported to Alberta Health. While our leading indicators of wastewater surveillance and positivity are signaling that we are on the other side of the fifth wave, and it is encouraging to see that hospitalizations may be at a plateau. At the same time, it is critical to remember that half of all of our cases come in the second part of the wave, and transmission is still very high. That is why we must all continue to look after one another, especially those most at risk of serious outcomes from the virus. The majority of us have a relatively low risk of severe outcomes due to a number of factors that can include vaccination status, younger age, and the absence of pre-existing medical conditions. But that doesn't apply to everyone. I'm sure each of us has several people in our lives about whom we care deeply, who are at increased risk of severe outcomes. With respect to COVID-19 impacts on schools, Alberta Education has provided the following update. As of January 31st, 22 of the more than 2,500 schools in Alberta have shifted to temporary at-home learning to address operational challenges, which means less than 1% of schools are currently operating online.